The health system in Sierra Leone is faced with a lot of challenges which has over the years hindered quality health service delivery, particularly for pregnant women, lactating mothers and children under 5.
We don't have enough instruments in the labor room. Like for the delivery sets, maybe if you have 2 or 3 women pushing together, you will not have 3 complete delivery kits to attend to them all. You will be there standing, waiting for this one, waiting for the instruments to be sterilized before you come to the other. If we have these babies, there are no cots in the labor room to put the babies when they have been delivered. Maybe we push the mother on the couch, the little couch there, you push the mother and then you put the baby by the side of the mother.
We have been having a lot of constraints because when the hospital was rehabilitated and handed over to us, we started admitting patients, but after 4 months, we had a huge number of patients turn out. So we had almost the entire ward got full with patients. So what we did was to extend to add an additional room where we admit the overflow patients. But within another couple of months, maybe 2 or 3 months, that one also got filled. So now, as I speak to you, 2 days back, we are having some of the patients on the floor.
That ward where we were using as the maternity unit is actually the female surgical unit. So it wasn't designed for maternity. So we were squeezed in there. All the patients were just jumbled up, you know, and it wasn't spacious. The labor ward wasn't spacious. We have to travel from out of the maternity to get into the theater. It wasn't a one whole compartment thing.
Electricity in most part of the country is a problem. Deliveries were done in most health facilities using a flashlight.
Lights not be needed. Yes. Attending a light, now they use this church light here. Now they use, but when I've been firstborn, now so manage no more. Take God pull me back, put well body long life.
To address these needs, the government of Sierra Leone, with support from the UNFPA, is working to step up health service deliveries for pregnant women, lactating mothers and children under 5.
Government launched the KAMA in 2010, and in the same year we launched the Free Healthcare Initiative, which will provide accessible and affordable healthcare services for pregnant women, lactating mothers and children under 5. And for that to happen, for free healthcare to be effective, for us to reduce maternal and child mortality, we had to do a lot with facilities improvement. And with the help of our development partners, we have multiple projects that we have undertaken to improve our health facilities. So improving them for us to upgrade to EmONC centers and CEMOC centers, for them to be well equipped with terms of human resource and equipment for to provide the services that we need for the pregnant women, lactating mothers and children under 5.
UNFPA is working with the government by ensuring that midwives are trained and are able to provide the service, and also investing in other infrastructure needs, what we call health system strengthening, to make sure that the service delivery is of quality and happens effectively.
As part of its support to the government, the UNFPA installed solar suitcases in health facilities around the country.
When I received the solar suitcase with the midwife cam, where I explained to them that they will get 4 delivery, we will be really happy over them. Even the lights will be used to do 2 episiotomy.
Availability of light in these facilities has increased institutional delivery. To further increase the accessibility of health service delivery, on the 7th February 2014, the government of Sierra Leone commissioned refurbished health facilities in Bo and Kenema. The facilities were upgraded by the UNFPA with funds from the African Development Bank.
This project is a major milestone in the Free Healthcare Initiative and the government 5-year development plan, Agenda for Prosperity, by getting new health facilities with state-of-the-art hospital equipment and infrastructure. We hope this project and its success story can be replicated in the other remaining districts.
As we all can see, it's a modern facility with state-of-the-art gadgets.
In its bid to ensure that women have access to safe delivery, similar health facilities have been refurbished in different parts of the country. How has this increased health service delivery and accessibility?
It is actually going to improve on the service delivery. One is drastically going to reduce the neonatal infection rate, because as you see, the facility is very, very spacious, and you see the wards, each of the wards has only 6 beds, unlike the previous ward. It was a general ward that had 14 beds, and we are keeping all the patients there. In fact, we are not even differentiating our patients. Both the postnatal, antenatal, post-operative, we are all in one ward.
Before, it was really difficult because you had little or no equipment. We usually work with clinical experience, and equipment, especially for diagnostic purposes, were almost, I should say, absent. But with this new building and the equipment supplied all new, it's really helping us in our diagnosis and also the treatment. It's a facility that will help us in reducing maternal mortality, as we are all working towards the Millennium Development Goals 4, 5, and 6.
The UNFPA has also supported the training of midwives and nurse anesthetists to further strengthen the human resource of health workers.
In the labor room, we have 4 delivery beds. We can deliver 4 women together. There are now enough cots to receive the babies. And we have like 3 incubators, and this will accommodate like 6 premature babies at the same time.
It is evident that with these facilities, institutional delivery has gone up.
Sometimes we have over 300 patients, and I can assure you, when you come in the morning, it's all packed full. So it's always a busy, busy day. And you have referrals from the PHUs. Sometimes we have patients coming from Kailaun district to Kenema district, not because of they can't access the Kailaun government hospital, but because some of the towns are closer to Kenema than to make it to Kailaun town. So we have patients all over, and this is the only referral hospital for the entire district. And you know, Kenema is a big district. So trust me, it has been a very busy day in, day out.
Well, now that we have a maternity ward, which should take up to 33 patients at one particular point in time, for now, I think with this new facility and with the number of wards we are having, I think we'll be able to have free space for all the patients that are coming in.
As the UNFPA continues to support the government of Sierra Leone to provide quality health care to pregnant women, lactating mothers and children under 5, the upgrade in reproductive health has paved the way to ensure that no woman dies giving birth.